So I'm going to talk for a second, so maybe get me in the...
Yeah.
So this is not the kind of skill that you can learn with distant learning on Zoom, I'll tell you. Because I don't know that this is as obvious, you know, that this side, and I've switched her around, but this is relaxed, these muscles are giving. You can also see her ASIS here, it'll drop, and if you're looking at her from her feet, you can sometimes see, like this side, what I'll feel. Well, this side, what I can see is I can see this, her ASIS looks like it's dropping, but what's happening is the muscles are just allowing her pelvis to move, and it's not integrated or connected. The muscles aren't kind of restricted in such a way that her lumbar spine is kind of locked into her pelvis, and that's what you see in motor control kinesiological studies using EMG, is that people quit moving independently in their lumbar and thoracic and pelvic region. They sort of move as a unit. So on this side, this is very relaxed. This tells me that she's moving independently on this side, but this side's very stiff. So these muscles, it's not like this is only, you can't just have this not function correctly on the left side. It is not functioning correctly on both sides, but this side is presenting more as the muscles really restricting her motion. I'm sure there's a corollary response on the other side. Otherwise, you know, people would be all shifted to one side, which does happen, but typically not. But, you know, if it was just happening on one side and this were going on, people would be like all locked up on one side and shifted, and that isn't, we don't see that commonly. We occasionally. But so she's stiff like this, and if you could feel this, she can feel this is stiff, I can feel this is stiff. So roll over towards me. And there's a number of ways you could do this. I'm just going to do this the simplest way for demonstration purposes. I'm going to roll her back, and then I'm just going to, what I want to do is I want to move the little bit, the tiny bit that her sacrum moves. I'm not putting, I mean, I'm not shoving at end range, like, I'm just trying to move her where her joints move. And what I can do is I can palpate to see if she reflexively kind of stops me. And so I sort of go this and that. And I mean, I can do almost nothing, but what I want to do is sort of unweight this area. And just to the degree I can sort of move the facet joints on this side. And what I'm doing is I'm just going where she moves. I'm just moving her where she moves, but I'm trying to move the joints in between my fingers, trying to move them all the way through the range of motion without the muscles around the joint reflexively contracting, an aberrant arthrokinetic reflex. And that's all I do. That's his. She felt nothing. She's like, how in the world could that do anything? And I agree. And then I look at this, and now this is just very super, it's not like it was. I know that the camera can't really pick that up. But then we're not really looking at this quite the same. But now this leg is flopped way down. And raise your leg up. And what she'll feel is it's a lot easier. You can let it back down and sort of raise it up slowly and raise it down slowly, or lower down slowly. And she's not going to cog the same way. And if you roll over,